All right. We are going to go ahead and get started. Welcome, everyone. My name is Maureen Muldoon. I am a career and internship specialist with SuccessWorks in the College of Letters and Science. And Emily, if you want to introduce yourself.
Sure. Hi, everybody. Welcome. So glad you're all here today. My name is Emily Faltersack. I use she, her pronouns. I'm a pre-health advisor with the Center for Pre-Health Advising. We're an office on campus that works with any student, doesn't matter what your major is. And we also work with alumni for no time limit. We help any student wherever you're at. We want to support you in exploring, preparing, and applying to health professional graduate programs. So that mostly includes things like med school, PA, dentistry, PT, OT, things like that. But we also can help students explore health fields broadly. So we're really glad to be here today on this panel. So I'll hand it over to Maureen again.
Yes, and I will add that I am a career and internship specialist for our healthcare and human services career community. And we are a career office on campus that serves students in the College of Letters and Science for all things related to career exploration through job searching, grad school prep, interviewing, career fairs happening next week. So all of those things. All right, to get started today, I just want to take a moment and recognize our career services colleagues that have helped to promote this event and to provide ideas for the topics, for the professions that we're going to cover today. The School of Human Ecology, the Education Career Center, CALS Career Services, the Follett School of Public Affairs, the Career Exploration Center, and many other campus offices and campus partners and advisors. So thank you all for helping get the word out. We're going to start by asking each of our panelists to introduce themselves and to provide an overview of your current role, what you're doing. Tell us about your academic background, your majors, what year you graduated, and kind of your career path to this point, where you're at. Panelists, if you have websites where you work or information you want to share with students, please feel free when after you introduce yourself to share that in the chat. Students, we're going to have a chance for Q&A after we go through a set of questions. Thank you for those who submitted questions. We got a lot of good questions. I did want to share that our panelist, Leah Iyengar from Medline, was unable to make it today. But I'm just going to share a little bit about what Leah is up to, and then we'll have our panelists introduce themselves. So Medline is a supply company, manufacturer, and distributor that brings clinical supply chain expertise to all different types of clinical facilities. So Leah says, I have been a product manager for urology products at Medline Industries for a little over 2 years, with previous clinical background working as a medical assistant at a healthcare technology startup. She is passionate about the healthcare industry and bringing access to healthcare to underprivileged areas. So Leah graduated in 2019, majoring in neurobiology and a certificate in business. Her email will be included in the follow-up email to everyone who registered. So panelists, to get started, Tina, if you would like to go ahead and share your current role, your education background, and your career path to this point.
Sure. Thanks for having me. My name's Tina Marshallek. I am the Community Relations Coordinator and a Health Coverage Navigator with Covering Wisconsin, which is a UW-Madison Division of Extension program that helps people find and use health insurance. I graduated from UW-Madison in 2021 with my bachelor's in community and nonprofit leadership, and I double majored in political science, and I did the certificate in educational policy studies. I was also the 2020 Truman Scholar from Wisconsin, and I interned with the Mortgage Center for Public Service with the UW South Madison Partnership. With covering Wisconsin, I'm a navigator. I'm state licensed and federally certified as a navigator, which is similar to a health insurance agent, but we don't sell anything. We help people navigate different health insurance systems. I can help people sign up with Medicaid programs and with healthcare.gov, but again, I don't sell anything, and I have different conflict of interest requirements than agents do, and I don't make any type of commission or benefits based on how people sign up. In my community relations role, I provide many of our professional focused and consumer focused trainings and workshops on health insurance literacy, health insurance options, and other health insurance topics like immigrant eligibility or the so-called Medicaid unwinding, if you've been following the news about that. I also manage our Community Mobilizers mini grant program, which supports outreach for community organizations across the state to connect consumers with health insurance resources. I am also the lead for the Central Regional Enrollment Network, which spans from Juneau to Jefferson counties and includes Dane County. Regional enrollment networks are one of covering Wisconsin's outreach programs. It's to connect stakeholders and partners together to share health insurance news and topics and co-create regionally and culturally relevant messaging and share ideas. I'm also the co-chair for Health Watch Dane County, the Health Watch Dane County Coalition, which is another stakeholder engagement group that connects different health programs and providers across Dane County to stay updated on all the work and services we do. So now that I've moved into the community relations role, I do a lot more of that partner engagement, but I do still sometimes work with individuals and families with signing up for healthcare and navigating the system.
All right. Thank you, Tina. How about Dylan next?
Sure. Well, Tina, you sound like an awesome person, so I feel like mine's going to be a little less fun. I'm currently a healthcare rate analyst at the Department of Health Services, which has a whole bunch of different offices and bureaus, but mine is in the Division of Medicaid Services in the Bureau of Rate Setting. So our office, I just learned from our director, is in charge of what ends up being 20 to 25% of the state's budget in any given year, because Medicaid is one of the biggest expenses that the state of Wisconsin has. I graduated from UW-Madison also in 2021 with political science and economics as my majors, and then I went to the La Follette School of Public Affairs in the accelerated program to finish my public affairs, Master's of Public Affairs. And then shortly after that, I ended up being right at the Department of Health Services. I actually got my start in the department much earlier than that in 2020, when in January 2020, I met someone from the Office of Preparedness and Emergency Healthcare, and I started there as a limited term employee. And then by the time I started in April and March, things had changed quite a bit in 2020. And so I ended up being the supply manager for the state's PPE warehouse. And then after that, I did a summer in the student internship program that the state does at the department, as well in the Office of Inspector General, where I was an auditor for Medicaid services and Medicaid payments. And then after that, I went and was a rate analyst for the department where I'm at now, which currently I am doing a lot of data analysis. So I am relearning how to code through SAS. I used a lot of R coding, which has been fun to do. Sure, I can say fun. But it has been a big lift to learn all these coding languages because I have more of a background in policy, but being able to bring the policy aspects and vision and statements from all of our leaders and put it into the policy and the data analysis we do has been pretty rewarding to see and a good time. So thanks for coming, everyone.
All right. Thank you, Dylan. Let's see, Emily, if you'd like to go next.
Hi, thank you for having me. My name is Emily Merkel. I use she, her pronouns, and I'm currently a graduate student. I graduated from UW in 2022 with a degree in global health and a certificate in environmental studies. And then after my 3 years at Madison, I came straight into grad school, and I'm currently working on my Master's of Public Health degree at the University of Minnesota. And specifically within that program, I am in the community health promotion cohort, and I'm also getting a minor in gerontology. And this is a 2-year program, so I'm currently in my last semester. And while in grad school, I do have a graduate research assistant position, and I'm helping with a longitudinal study looking at the risk of atherosclerosis in communities through the School of Public Health here at the University of Minnesota. And in that role, I do a lot of participant recruitment and enrollment, consenting, and running visits with participants. In regards to previous internship experiences, I've had internships in nursing homes. I also did the state of Wisconsin internship in the Department of Health Services. And most recently, this past summer, I had a public health internship in Kenya, where I traveled abroad and lived and worked in a remote island in Western Kenya off the coast of Lake Victoria, doing public health work and working with a couple other graduate students on their field experience, helping revamp and improve the public health radio broadcasting program that this community organization has. And then after graduation, I plan on taking the summer off a bit just to have a bit of a break from school to do some traveling. And then I recently accepted an invitation to serve as a Peace Corps volunteer. So I will be going back to Kenya in September to serve as community health outreach volunteer for about 2 years after that.
Wow. You've got some big plans ahead. Thank you. And Ian, if you'd like to go.
Yeah, hey everybody, nice to meet you. My name is Ian Norman. I studied biochemistry at UW and got a certificate in business. I graduated back in 2016, and I actually was waitlisted twice for an MD MBA program out at Tufts. I knew I was always interested in kind of the business side of medicine. So I know some of you are juniors, seniors. If your first plan doesn't work out, trust me, the universe has a way of putting things in your path that'll work out well for you in the long run. So after that, I ended up at a distributorship selling predominantly ophthalmology products, so cataract supplies, blades, the implants, those kinds of things. Started to get into the OR, and then that company was actually shut down last year. So in May of last year, I started my own company with a group of sales reps from Precision Lens, my previous company, and we started Align Ophthalmics. So doing a similar thing, supplying cataract surgery supplies to surgeons, hospitals all throughout the Midwest. We cover 12 states. We've got a wide variety of manufacturers we work with, so I'll throw our website in for anybody that's interested and wants to get a little more information. And in addition to that, I wrapped up an MBA at the University of Chicago last year. So if anybody has any questions on business school, those kinds of things, I'm happy to talk to that as well. I manage a lot of the operations and finance for Align.
Wow. All of you have done such interesting things, and we can already see some of the questions getting started. I'm going to hand it over to Emily.
Great, thank you, panelists. Okay, so we've got one more question for everybody before we get into some of the questions that were submitted in advance. So the question for everyone is, tell us more of what your work entails. What might a typical day look like? And I'll put that in the chat as well. And I know it might vary a bit based on if you're in school or out of school. But let's get started with Tina for that question.
Thanks. A typical day looks like reviewing any health insurance news, policy or program changes, and communicating any new information to partners and stakeholder groups and among our own staff, and updating any materials relevant, drafting any external communications relevant to any changes in health insurance news, communicating with my networks, the Central Regional Enrollment Network and the Health Watch Coalition. I'm almost always preparing, coordinating, or giving a presentation, whether that's a workshop or a training or just a presentation on who we are and what we do. Possibly having a consumer appointment, which means meeting with an individual or a family and assessing their situation and helping them either sign up for coverage or just problem solve a situation and connect them with resources. Possibly attending, coordinating, or planning an event. Often distributing or creating outreach materials, often co-creating any educational materials with other staff or with stakeholders and partners. Checking in with our community mobilizers, possibly chairing a meeting or providing feedback on messaging or program and policy changes to state and federal partners. It's a lot of communicating, a lot of co-creation.
Okay, great, thank you. Okay, let's go to Dylan next.
Yeah, so kind of like I said in my intro, it is a lot of data coding. So the reason BRS, our bureau, exists is to be able to kind of set the prices that the Medicaid system will pay out for members and participants in the Medicaid system for the state of Wisconsin. And so what we take is a lot of the data that's been collected over years and years, summarize it and analyze it in a way that we can pay fair rates out to providers that will also ensure that the folks in our system have access to the care that they need, because that is the whole point of Medicaid in the first place. So it's been a lot of searching up online how to code something in one coding language and then do it in a different one. You run it and then it doesn't work and you have to figure out why, and then you ask a coworker. But it is a kind of a fun process because you're sort of building a lot of these investigations from scratch sometimes, or updating them as policies change and different services get looped into the program. I specifically set rates and do rate setting for a program called IRIS, which the long form name is Include, Respect, I Self-Direct, which is a self-directed care program for people with long-term disabilities or developmental disabilities. And so this program is one where the person themselves receiving the services will get a budget from the state, and then that person is able to decide who comes to give them their cares, who gets hired or fired to do that, what transportation service they do, and they have a lot more authority over the care that they receive through this system. So it is a really fantastic service for the members who receive, or the participants that receive services through it. And so it's just fantastic to support that type of a system that gives people that power over their own lives. But it takes a lot of data analysis to do it. And then from time to time, we will also research Medicaid systems in other states. So recently, a couple coworkers and I did a comprehensive review of the other self-directed programs in the United States of America, where you really get to dive deep into the publicly available information about what other Medicaid programs are doing. So it's a lot of policy comparisons going on and trying to see, okay, how would what, say, Minnesota does impact our program, which is my favorite part as a policy person. But my daily thing is being frustrated at code.
Thanks for sharing. Okay, let's go to Emily.
Yeah, my day honestly looks pretty similar to what it did while in undergrad, and it probably looks pretty similar to what a lot of your typical days will look like, with a varying class schedule. No day quite looks the same, but usually a mix between classes and work and class meetings. A lot of my courses have group presentations and group projects and a couple papers opposed to exams. So a lot of meeting up with classmates outside of class to work on those. And then also just incorporating some like volunteering and extracurricular events as a grad student. This semester, I do only have 2 in-person classes on Wednesdays, which is kind of nice, with a little bit more flexibility of having some online classes this semester, and then pretty much, again, working in between that.
Thanks, Emily. Okay, let's go to Ian.
Yeah, so I wear a lot of hats as a startup, but I'm usually in the OR 2 to 3 days a week. I think it's really important to get as much customer facing time as I can so that I understand their problems. We also routinely launch new products post FDA approval. So a manufacturer will develop a product, maybe they don't have their own sales force, and we bring it in-house. So there's a lot of collaboration with doctors on using products that are newer to the space. Maybe it's similar to something they've used in the past, maybe it's not, and finding a spot for where that fits in the patient care spectrum. So one of the devices we're working right now is a new glaucoma device. So I'm in the OR 2 to 3 days a week. And then when I'm not in the OR working directly with customers, it's a lot of interviewing as we continue to expand. So I had an interview this week for a new customer service person. We're actually looking at potentially making an acquisition here before the end of the year. So I've started to spend a little bit more time talking with bankers and lining up some financing and those kinds of things. So it does change, but the heart of it is spending as much time with the customer as we possibly can and making sure that our operations are in a good place to serve them.
Great, thank you. Okay, well, I'm going to pass it back to Maureen so we can get into some of the questions that were submitted by all the students.
Yes. All right. So for all of you panelists here tonight, thinking about when you first graduated, whether that was a few years ago, just a year or two ago, and thinking about clinical professions, administrative professions, trying to carve your way, right? How did you decide between attending graduate school and entering the workforce? So are there any of you who went directly into a program versus got some experience and then went back to school?
I could maybe start. I came
Sure.
straight to grad school from undergrad. I think knowing I came into undergrad thinking that I wanted to go to medical school, and then that kind of shifted throughout undergrad. And then knowing that I wanted to go into public health and learning more about public health as I was approaching graduation, and doing informational interviews with people in the field, I noticed that a lot of people had their MPH degrees, their Masters of Public Health, and I kind of always knew I wanted to get more experience in school and higher education. So I knew that was something I would want to do in the future. For me, it worked out well to do that right after grad school because of graduating from undergrad in 3 years, and a lot of that was during COVID. I felt like I didn't quite have the college experience, and my major was global health, which was brand new at the time. So I also felt like I didn't quite have all of the tools and knowledge that I felt necessary and that I wanted to do well in public health. And I think grad school has been a great opportunity to continue to build that public health knowledge and skills and provide me with the opportunity to strengthen those skills. So now I feel even more confident after the Peace Corps to go into the workforce.
Absolutely. Yes. Let me see. I'm guessing Dylan, I know since you have done grad school.
Yeah, so I did an accelerated program at La Follette, which is at UW-Madison as well, where your senior year of undergrad, you actually are doing half and half. So half of your credits, half of your courses are graduate courses, and the other half are you finishing out your last year of undergrad so that you have one full year of graduate school and then you get to be done. So instead of it being a 6-year stint in all of the schooling, it's actually just 5. Which has its trade-offs because you lose some time that you could take some more specific courses at the graduate level. But it also has the benefit of graduating yourself a year early, which is fantastic. So I had decided, I think about sophomore year, that I wanted to try to pursue that accelerated program. I was a political science and economics major, and I knew that I was gaining a lot of skills from the economics courses in the way that you can do some computations and everything. And then I felt like I was having a lot of fun in my political science courses, but did not necessarily see how those skills were going to be applicable totally into the workforce. And so I was looking to kind of move into that policy area through the La Follette School. And so that's why I decided to go down that route. And I think it really did help because you are able in a program kind of like the La Follette Masters of Public Affairs program pick specific courses still that align with what you do. For example, there's a health policy and programs course at the La Follette School, taught by somebody who used to be a pretty heavy hitter in the Dane County public health system. So she has a lot of hands-on experience, and it was a great opportunity to get a bird's eye view of policy systems in healthcare. So it was just kind of a lot like Emily, where it's like, undergraduate was fun, but where are the hard skills that are going to be helpful? So that's kind of why I did it.
Yeah, absolutely. That makes sense. Emily, you want to take the next question?
Yeah, and I did just see Tina unmute. Tina, did you want to add anything to that?
I know we're pressed for time, so I didn't want to mess with the flow of things.
We're
I
good.
can offer the alternative perspective where you didn't go to grad school.
Yes.
I'll be brief since I know of time. I did attend many educational sessions on different grad school programs when I was in my senior year, and many of them said that they were looking for applicants who had post-grad work experience. I think that was the biggest thing for me, that I would have a stronger grad school application if I didn't go to grad school right away, according to what I was hearing at those specific education sessions. Once I was actually working, it's so nice to make money instead of spending it. Oh my goodness. I personally don't feel like I've plateaued in my career such that I need to go to grad school right now, but I could definitely see that happening within the next 10 years or so. So I probably will. But there are definitely pros and cons to both.
Absolutely. Great perspective.
Yeah, thank
Yeah,
you.
I'll echo what Tina said real quick, as I mean, as I told you guys, I had planned on doing an MD MBA, so it actually was not a decision I made myself. But you know, I worked for about 4 years before going back for my MBA at the University of Chicago, and I really think that that helped me develop and understand what I was interested in. And quite honestly, that's why I honed in on just doing an MBA. I think if you know for sure that you're interested in something like public health and you want to get an MPH, that's great. But if you're unsure, don't feel like you have to just jump right in. There's plenty of time. Like Tina said, you can go out, you can try different things, find out what you like and don't like a little bit more, and then make a decision.
Yes.
Thank you.
Absolutely.
Thanks for that, all the different perspectives on that one. Okay, so the next question that was submitted in advance, and feel free, students, anyone who's here, put questions in the chat if you want us to get to them, but we're just going to go through some of the questions that were submitted in advance right now. And I'll probably have 2 to 3 of the panelists answer this one, so feel free to raise your hand or your virtual hand if you want to answer. If you don't get a chance to answer, feel free to pop something in the chat. So this question is, did you take any classes or complete any extracurriculars while in undergrad that helped you decide on your career path? And I guess this could even be applied to anything you did even after undergrad that helped you decide on your career path too. So anybody want to get started with that one? Dylan?
I can hop in and just talk more about that health policy class. And I've seen a lot of people from from the I'm forgetting the word, but from SOHI, the school, and other programs that have are kind of like public health and health adjacent. So definitely trying to get a policy course is fantastic when it comes to healthcare. So this healthcare policy course that I took was one where they brought in policy students, they brought in masters of medical engineering students in, they brought in social worker students, and had like this fantastic huge discussion of all these healthcare systems and all these different perspectives people had. It would basically be like a class where Tina, Ian, Emily, and I are all together, and it was just fantastic to hear it. And I think it was really a catalyst to saying, okay, maybe going into the healthcare administrative aspect is really important, because it's really at that higher level where you can make some big systems changes, especially what Tina's doing, which is working with all these on the ground folks. So that course, I could not recommend it anymore to anybody who has the chance to take it at UW, because it really is fantastic. It's health policies and programs, and I'll try and look up which class it is specifically and put it in the chat. But the last thing I want to say quickly is also internships are almost more valuable than any course you could take, because what you learn in that is really what people are going to be looking for when you're out on that job market. So
Thanks, Dylan. Did anyone else want to jump in?
Yeah, I'll echo what Dylan said on internships. And just as an example, I worked at a lab. It was the Burlingham lab. I think it's now run by Professor Matthew Brown, who was a grad student at the time, and he and I still keep in touch. He's a wonderful man. But what I learned through that is I really do not like lab work, which is interesting for a biochemistry major. So, I've kind of, the theme is go out, try things, right? And it's okay if you don't like them. And that, to me, I think I was late junior year, early senior year, when I was like, man, I really don't want to go work in a lab when I graduate, right? So that helped me understand, hey, there's a shift here. Like, I need to start to look at other things that I can do outside of just lab work with my biochemistry degree.
Yes.
Yeah, I so relate to that, Ian. Sometimes knowing what you don't like is a really important thing.
Yeah.
Did anyone else want to answer that question?
I can jump in. I would agree with both Dylan and Ian that internships are super important, and they don't have to be like a big scary thing off campus. They can be something very much on campus. My last year at Madison, I was a peer advisor intern at the Mortgage Center for Public Service. And I think that role really taught me what like meaningful and respectful community engagement was and looks like. And that's kind of the mission of the Mortgage Center. So definitely check out the Mortgage Center if you haven't yet. But those sentiments have just definitely really stuck with me and definitely influenced my decision to pursue my MPH in the community health promotion track, opposed to like epidemiology or maternal child health. Yeah.
Thanks, everybody. I'll pass it over to Maureen for our next question.
All right. How do you see the work that you do contributing to advancing health equity?
Pick me.
Tina, what
Thank
do you think? Yes.
Yeah, so I think that I'm in kind of a unique position working for a health program because we focus on health insurance, but to access health care and ultimately work toward reducing health disparities, people need access to affordable health coverage, and they need to understand how their insurance works so that they feel comfortable using it, knowing that they're not getting themselves into medical debt. And getting people health coverage allows them to get many preventive services for free, which prevents bigger health issues down the road. Through outreach programming, you can make deliberate efforts to connect with communities who are more likely to be uninsured or who are at greater risk for needing affordable health care, like people who are more likely to be uninsured in Wisconsin are often low-income people and many communities of color, many immigrant populations too. But also there are some groups that just don't have the same proximity to affordable health care as other groups, like people who are pregnant. And many people with disabilities, many people living in rural areas and so forth. So advancing health equity, it requires improving health insurance access and affordability for traditionally underserved populations and those most likely to need access to care.
Absolutely. Yes. Who else would like to tackle this one? The floor is open.
I can try and jump in, Maureen.
Yeah.
I think Medicaid is a really huge program that at least is from the government aspect for health equity. I think it's specifically the program I work for, IRIS, where you're trying to put people in charge of their own health care, even though they're part of a government system, is putting a lot of respect and trust into folks to make sure that they are able to guide their own lives. Especially the folks served by this program, they have mobility challenges. The world's not very kind to them in many ways. And so giving them that control over their own life is, I think, a really fantastic thing that the state does in part of the Medicaid system. But across the board, working in Medicaid, there are like in Wisconsin, I think 200 different positions in the Division of Medicaid Services. And the whole enterprise is kind of geared towards being able to ensure access to people who are covered by Medicaid. Of course, there's always the cost consideration as well. But I think that you can really, really make a big impact, even with the small decisions when you work in the Division of Medicaid or in any Medicaid adjacent company as well.
Yep, absolutely. All right. What's our next question, Emily?
Yeah, I'll pop our next question in the chat. So the next question is, what are your top tips for getting a job in your field right after school? Related, are there skills you recommend students prioritize if they want to enter the workforce right after undergrad? So feel free to raise your hand if you'd like to answer that one or put something in the chat.
I think my number one tip is going to be network. Obviously, I'm a sales guy, so I tend to like to talk to people a lot, but you would be absolutely shocked the people that you have access to just through your UW email address. And people really want to help. Just reach out to them and just say, hey, I'm considering this career. Can I buy you a coffee? And I would tell you, more times than not, you're going to get a yes. I mean, I still will reach out to doctors and say, hey, I'm new. Like, do you mind if I come into the OR and ask you some questions? Right. And make sure you're prepared and you understand what it is that they do a little bit. Spending the time doing your due diligence on Google, etc. But really find a field that you think you're interested in, find people in that field that you think you can talk to, and then network through the university, through friends, through whoever you can find that might know somebody, just to get an introduction.
Thanks, Ian. Yeah, networking can definitely feel like a scary word, but it's, just building those relationships is so helpful.
And I will say, anybody that's interested in talking to me personally one-on-one, I'm happy to chat with. I think Maureen will provide my email, and I'm more than happy to talk to you and introduce you to somebody that can help.
Absolutely. Take advantage of that.
Okay, any other panelists who wanted to answer that last question? I'll put it in the chat again.
So Dylan mentions Learn Excel. For all of you who are on LinkedIn, even if you're not, there's LinkedIn Learning that you can access to work on your pivot tables.
I would say gain as much experience as you humanly can while you're in undergrad. Now that I am somebody who looks at resumes sometimes, what is challenging when people are right out of college isn't that we're not willing to take a chance on them necessarily. It's that their resumes are pretty bare. They maybe did an internship or two, and they have their degree, and that's it. And that just doesn't give you a whole lot to work with. And when you're interviewing for a job, you're mostly just convincing them that they can trust you with this job to do these things. So I would get as much experience as you can. Something that did make me stand out was that I was technically a returning student. I went to college 2 years later than most people did. So in my mind, that's not much of a return. But according to UW's rules, I was a returning student. So I did have a couple more years of experience on my resume than was typical for an undergrad. And I just didn't put the year that I graduated on my resume. That's my tip. You don't have to put the year you graduated. And people assumed that I graduated years and years ago. And I just let them because unless they specifically asked, what year did you graduate? I don't have to tell them. And one time I was asked directly, when did you graduate? And when I told them 2021, they went, did you go to grad school? And they picked up my resume again. And I had to explain that no, I'm sorry, I am fresh out of college. Yes, you caught me.
That is so funny. I think that's incredible advice. I've served on a couple hiring committees as well at the department so far, and I can't agree more with Tina. If you kind of struggle with the idea of working or doing an internship during the semester, because I know it can be a lot for folks, look for classes where you have a capstone project or you have deliverables. That's what we kind of call them at the department, deliverables. that you're going to be able to prove that you've done the skills. So capstone projects are a great way to pretend like you were doing a job for that class for the semester, because it will have a finite project at the end that'll be applicable somehow in the industry.
Good advice. Absolutely. Kind of tied into that. And there's a question in the chat about advice for getting an internship in the healthcare field. Most of the policy ones are located in DC. So I'm guessing this is more specifically policy related, maybe in Wisconsin. And I'm going to ask Dylan on this one.
Okay, I just wanted to hop in. I'm going to put a link in here to, I think, what Emily and I did back when we did our internships with DHS, which is called the Student Diversity Internship Program, which is the state of Wisconsin's initiative to get college students and some high school students into government positions. And Wisconsin's Department of Health Services has a lot of internships that they open up. Oh, sorry, my light went off. That they open up to students who are in college, and they are almost always somehow related to policy when they're at the Department of Health Services. So you might be able to find some that are private industry as well. I don't know, but I do know that DHS, Department of Health Services, also Department of Children and Families can have some health policy related internships as well. And they pay. So that's the fantastic part.
Excellent. Great advice. All right. Let's see. A question that came in earlier, talking about medical device sales. Ian, this one would be for you, and just leadership in general related to healthcare. What would be your advice if you don't have specific medical device sales backgrounds?
Yeah, so that's kind of where the networking comes in.
Right?
So to expand on my background a little bit, after being waitlisted twice for an MD MBA, I accepted a job with a vascular medicine company called Vascular Solutions out of Maple Grove, Minnesota. I was halfway around the world in Sri Lanka. They got bought, and I lost my job before I worked a single day there. Just so happened that I had lunch planned with the gentleman that founded Precision Lens. He was a guy that I had known since I was like 16, and we were just getting together to catch up and talk about after I'd graduated, and I had kept in touch with him through undergrad. And at lunch, he was asking me about the new job and how excited I must be. And I kind of had to sheepishly say, oh, yeah, the company got bought and they eliminated my position. And he offered me a job on the spot.
Wow.
So yeah, for like half the money that I got offered at the other company, but for whatever reason, I thought it was the right opportunity for me. And I just kind of set the compensation aside and I said, look, that's not going to work for me long term, but tell you what, why don't I come work for you for 6 months and then I get to renegotiate my compensation? And he agreed to it, and the rest is kind of history. So as far as breaking in, I mean, it's not an easy field to get into. I'll be straightforward with that. A lot of people will go through things like printer sales, and then they'll go into pharmaceutical sales, and then slowly work their way up. But that being said, there are actually a lot of smaller companies out there. They tend to be more on the distribution side, and you should be able to get a foot in the door to have some conversations. And then you just have to be willing to do all kinds of different things to prove yourself. I mean, I literally showed up on the first day and I was using pig eyes to set up a wet lab, and boy, oh boy, do those stink, right? But just volunteer to do those kinds of things and you can continue to prove yourself. I think for a lot of you, you're at the University of Wisconsin, so you clearly have pretty good head on your shoulders and are willing to work pretty hard. And it's also a big university, so you learn to advocate for yourself and kind of turn the experience into whatever it is you want it to be. And if you carry those skills over to whatever your first job is, whatever your first opportunity is in grad school, out of school, I think you're going to find that doors will continue to open. And you got to remember that it's a marathon and not a sprint. So
Very
hope that's helpful. I know it was kind of long-winded. If there's anybody that wants to connect on med device sales specifically or anything like that, happy to talk to you one-on-one.
Thank you. Very true. How about the next question, Emily?
Yeah, and I'm just noticing the chat too with some great tips and ideas of ways to get internships or other experiential learning opportunities. So thanks for that, everybody. The next question we've got is, how did folks know if you wanted to go into a non-clinical setting for grad school or a career instead of a clinical career, like medical school, for example? And I'll put that in the chat. Anyone want to get started with that?
How about Emily?
That's a good question. That was a big challenge for me during undergrad, the transition from thinking about going into a more clinical field like med school to non-clinical. I think it takes gaining experience to kind of in everything and anything. Like people were saying earlier, that learning what you don't like is also good, and getting new experiences, stepping outside your comfort zone, stepping outside of the box a little bit to something that you maybe didn't think you were initially interested in could sway you another way, and taking classes, whether that's classes or like an internship experience. So I would just say be open to explore and being open-minded when doing those new things and being willing to try new things.
Yeah, thank you, Emily. Anyone else want to answer that one? Ian.
I'm sorry,
Oh.
Emily, to cut you off.
No, go ahead, Dylan.
I don't think I ever wanted to be a nurse or a doctor or anything like that. I almost was a teacher, but not a nurse. However, within the department, there's a lot of people who were nurses or were doctors and then came out of the clinical setting and into the administrative setting, because a lot of oversight positions require people to have that, on-site experience of being in the wards or in these different healthcare settings. So if you decide to go clinical setting and then you don't like it, there's certainly plenty of positions for you to change course after a year or a couple of years.
Yeah, there are so many people that are so needed to make the healthcare system operate, and especially in roles that maybe we all don't think about first off when we think about a healthcare role. So thank you all for being here. Anyone else want to jump in on that one? And students, please submit more questions to the chat or raise your virtual hand. That's great as well.
I'm wondering, for Tina, given that you're more in an administrative setting, had you ever thought about something clinical?
No, and that's why I wasn't answering. Because
Okay.
I never really was even considering going into a clinical setting. I wasn't really even planning to work on a health program. I was more focused on education when I was an undergrad. And what attracted me to covering Wisconsin was more the consumer protection and anti-poverty angle, that having health insurance protects you from financial ruin. And I have worked on many programs and projects that were focused on low-income people and or were focused on financial stability and economic opportunity. So it was a happy accident, as Bob Ross would say. And maybe that is good advice right there, that sometimes you might just find yourself in a job that you were definitely not expecting to be in. I was kind of expecting to be in education policy, but I am happy here, and it's a very worthwhile cause that I landed in a good spot.
Absolutely. Yeah, I think, part of trying to chart your path is what are the aspects of healthcare that interest me most? How do I want to help people? And what are the skills that I have, the strengths that I have? And everyone here is either learning skills on the job, right? Like coding and pivot tables, and then talking to people if you really do like being on the front line, right? That's getting out there and still being in a clinical setting, but using more of the communication skills. Jack is asking, for Emily or Ian, did you ever consider an MHA opposed to an MBA MPH? What made you lean towards the program you chose?
I can start. I personally did not consider getting an MHA because my mom's in healthcare administration, so I've seen her in the workforce, and that's not kind of what I wanted to do. And also, MHA is a little bit more business focused, and that's not quite as much my interest. My interest is very much more in the traditional public health work. So that's why I decided to stick with an MPH. But I will say, I think a lot of the skills are transferable in any program. And there are, at least at the University of Minnesota, there's also overlap in electives and courses where an MHA could take an MPH class and vice versa.
Yeah, I have a very similar answer to Emily. It maybe differs a little bit in the fact that I was very interested in the business side, so almost the opposite, where the MHA didn't have enough business for me. But I agree, there's a lot of overlap in the programs. I actually took a healthcare administration course at the University of Chicago that was, it was a bunch of doctors and nurses and a couple of business school students. So pretty much any program you look at, there's an opportunity to cross over. Ultimately, and this is where I think a little bit of career experience helps, it comes down to what you're most interested in. If you want to run a hospital, an MHA might make more sense than an MBA. If you want to run a business like a distributorship, the MBA might make more sense. And then if you want to get involved in, healthcare policy and those kinds of things, an MPH might make more sense. But either way, you're going to have the ability to tailor your experience, kind of like you did with your undergrad experience.
Thanks, Emily and Ian. So we had another question submitted. It was specifically asking about, Emily, with your global health major, how you feel like it's benefited your grad school job search. But I think we can expand it to all of you to think about your undergrad major. How has that benefited you with your job search, grad school, career?
Yeah, unfortunately, with COVID, I was unable to study abroad as I was hoping to during undergrad.
Looks like Emily froze. Does someone else want to jump in and answer this before she comes back?
I guess I can. I think I saw that there were a couple community and nonprofit leadership majors in the chat. I will say, I know that there has been so much contention over the title of our degree. And when I was a student, I kept saying it should be nonprofit management. People aren't going to take me seriously. But once I was in the field, people love it. Like, they love the degree title. My post-grad fellowship that I had that summer, I was told that I was selected because of my degree, because they were looking for somebody who could help facilitate nonprofit partnerships. So it has definitely helped with looking for community programs and just showing that I have experience with nonprofit organizations, because it's kind of new. There are not a whole lot of candidates who can show that they have academic experience with nonprofit organizations. It's usually something that people learned hands-on, and many people who learned nonprofit organizations hands-on didn't have any kind of technical skill training for running a nonprofit program. And many people who majored in business were planning on going into the private sector and not the nonprofit sector. So there's kind of like a gap there. And I ended up being able to close the gap a little bit.
Excellent.
Thanks,
All right.
Tina. Dylan or Ian, did you want to answer that one?
I really like my political science degree, but I don't know how much it helped going after that. Sometimes I think it teaches you how to write a constitution, but not be in the job market. My economics degree, though, I think really did help set me up for graduate courses, especially in policy, and then related to health policy too, because at the administrative level, all health policy is at some level economics. Even though you're trying to tie it to health outcomes, it's really going to be tied to people's individual financials, a business's financials, and how the money flows, and having those economic understandings and how to frame questions are really important. So I found that the economics degree was helpful.
Absolutely.
Yeah.
All right.
Oh,
Go ahead.
go, Maureen. To Dylan's point, they say finance is the language of business, but I don't do any biochemistry anymore. And what I would tell you is that what I was learning was how to learn, right? What I do routinely do is I read white papers and I analyze scientific data. And, I didn't learn specifically how do you analyze a case study about glaucoma when I was at the University of Wisconsin, but I did learn how to think critically about problems. And that would be the number one thing I would say you're focusing on right now is just learning how to learn. I mean, the pace of innovation continues to accelerate. We've got Chat GPT and all kinds of new AI initiatives. And I can guarantee you in 6 years from now, the workforce probably isn't going to look like it looks today. But all of you will be in a good place where you can learn how to adapt and continue to drive value for the organizations that you're a part of.
Okay, and Emily, glad you're back. Did you want to jump in?
Sorry, could you repeat the question? I'm not
Yeah,
awesome.
of course. So the question is, how has what you majored in benefited your job search?
Well, I kind of just spoke about it earlier with global health, and then that's kind of led me to the Peace Corps. So
Yes, tons of intersections there. Okay, well, I'm going to pass it off to Maureen to go to our last question.
Yes. And while I'm getting to our last question, Emily's going to share our feedback survey in the chat for any of you who would like to share more. So after listening to all of you today, what is one step or one action that students can take as they continue on their journey exploring healthcare careers beyond clinical settings? What is one step or one action students can take?
I can jump in.
Sure.
I would challenge you all to find 3 people that you haven't spoken to before that are in a field that you think you're interested in and try to speak to them by the end of the month. I mean, we talk a lot about SMART goals in my organization, so specific, measurable, actionable, realistic, and timely. So find 3 people that are doing something you think you'd be interested in that you haven't spoken to before and try to speak to them. It can be 5 minutes, it can be 10 minutes, but try to do it by the end of February.
Yes. All right, who's next?
You can tell he runs his own business, I mean, it's just impressive. Because I was just gonna say, really work on trying to find an internship that you think you would like and apply. Like make sure you apply to it. And even if you don't get it, you'll know the process to get that internship. You'll know what type of field you want to try and get into.
Yeah, absolutely.
Similarly to what Ian said, I think informational interviews were really helpful for me in undergrad because people are more transparent when they're talking to you one-on-one than they might be maybe at an event like this. Not that I haven't been transparent. I'm pretty transparent. I don't have secrets. It's actually pretty bad. Everybody knows everything. But that did give me some intel when maybe I might have thought somebody's job seemed really cool. And then once I talked to them one-on-one, I thought, I don't want to deal with that. Or the other way around, if I thought that didn't sound like a job that I'd be interested in, and then they talked more about what it was like day to day and what the politics little p were like, and I may have thought, that actually sounds like something that would be fun to me. So I'll leave the SMART goals up to Ian and just leave it broad and say, try to do some informational interviews if you find somebody who has a career that is just interesting to learn more about.
And then I would just add to try something new, to step out of your comfort zone and explore areas that you might think that you're interested in, or maybe something totally out of the box because you might find that you're interested in that too, and that could lead you down another path.
All right. Was that everyone? I think we got everyone. We're right at 6 o'clock. Tina and Emily and Ian and Dylan, thank you so much for your time this evening and sharing your wisdom and expertise at this point in your careers. And students, we will follow up with an email. And this recording will be available for those who weren't able to be here in person. So thank you all again for coming. And students, if you want to thank our panelists as well, feel free in the chat. And we will have a follow-up email. So good luck in your next chapters, all of you, in your work and school and travels, all of those things. So on Wisconsin.
Thanks, everybody.
Bye. Thank you all.
Thank
Yep,
you.
thank you. All right. Good panel.
Okay, 1 second here, Maureen. Jacqueline, did you have any questions? There we go. Okay.
You stopped recording?
I think it's actually on your computer because I made you the main host.